all, and welcome to Crohn's Chronicles. Today I'm going to start a shit series. So, in shit series, there will be a number of episodes wherein I'll be talking all about shit.
Alright.
So, let's start. Pretty much all of us have experienced diarrhea from time to time. It could be due to change of food, infections, or use of antibiotics, or due to traveling. So all these could lead to diarrhea. Diarrhea is passing of stools, liquidy or watery stools, more than 3 times per day or more frequently than that is normal to you. What happens in Crohn's disease is that the cells of the intestinal lining are inflamed, so they cannot absorb water and nutrients. So what happens is all this water is passed along with the stool. So that's the reason we have watery stools. And these loose stools can very rapidly move through the bowel. So we have frequent bowel movements. In Crohn's disease patients, the diarrhea might last from few days to few months. I had like diarrhea for few months, and you have to be bedridden all the time, and then I would have a small remission period. Then again after few days I would have diarrhea again for another 2 to 3 months. So it was like I had diarrhea for almost the entire year. The causes of diarrhea in IBD is IBD itself, and other infections which are associated with IBD, like it could have a Clostridium difficile infection. I had a Clostridium difficile infection. It could be due to the use of antibiotics, and if you have had a small bowel surgery or a colectomy. So if you have a colectomy, then your entire colon is removed, and obviously your water cannot be absorbed, and you'll have liquidy, watery diarrhea. My experience, I have seen that whenever I go through some kind of stress, there is always an increase in frequency of the stools. Certain types of foods are also known to cause diarrhea, like fiber-rich food or high spicy foods, or intake of alcohol, caffeine, more of sugars, drinks, the carbonated or the aerated drinks, and those who are gluten sensitive, they have gluten diet, like bread, cakes, or pasta or wheat. They could have diarrhea, and in those who are lactose intolerant, intake of dairy products can also cause diarrhea. If you are Crohn's patients and you're having diarrhea, if you see there is increase of frequency of bowel movements, or there is change in consistency of the stools, that is from solid, liquid, or even watery, or then it's advisable to go to the doctor as soon as possible. When you visit the doctor, certain questions are expected, like when did diarrhea start, what is the frequency of the bowel movements, like how many times you visit the bathroom. It can range from, if an IBD patient, a Crohn's patient, can range from 10 to 15. And if there are any nocturnal symptoms, like do you have to get up in the night to pass stools, or if there is any incontinence, that is, are you able to control your bowel movements before you reach the toilet, and they would ask you to describe the stools, that is, whether they are watery stools or liquidy stools, and if you're passing any mucus, pus, or blood in stools. If you're having ulcers in your digestive tract, then you might have blood in your stools, and they'll ask you the color of your stools, if it is green or normal yellow color, or black color stools could also be due to iron intake, iron supplements. If you're taking iron supplements, then your stool could be black. And then they'll ask you if it's associated with any pain, and what makes it worse, like what kind of food makes it worse, or what kind of food makes it better. And they can ask you if you have traveled recently, if there's any change in your diet, and if there is any family history of IBD. So after taking this proper history, doctor will try to look at your abdomen and touch it, and listen to the bowel movements. He or she might perform a rectal examination to see if there's any perianal disease. Coming to the investigations that you might be asked for, are a routine blood tests to check for anemia and for any inflammatory markers like C-reactive protein, which increases in inflammation, and a stool test to rule out any bacterial infection. Another specific stool test for inflammation is the fecal cal protectin test, which indicates inflammation in your body. After preliminary treatment, you might be advised for a colonoscopy. So what can you do at home for diarrhea is, even though if you're not an IBD patient, a normal patient, normal person having a diarrhea, so what can, the most important factor would be change of your diet. Eat small and regular meals. If you're gluten sensitive, avoid wheat, barley, pasta, cakes and bread sort of things. If you're lactose intolerant, then avoid dairy products like milk. Stop having spicy, fatty foods and limit fiber intake. Talk to your IBD specialist and talk to your dietitian to have a nutritious and balanced diet during diarrhea. If you're a Crohn's patient and your ileum is affected, then it becomes difficult to absorb fats. That is, there is malabsorption of fats. So this leads to pale, oily, foul-smelling stools which float and are very difficult to flush away. What kind of diet you can have in diarrhea is have clear liquids, have high potassium foods like coconut water and bananas, have high sodium foods like broths or soups, and have fresh juice without sugars. Have food which is high in soluble fiber like bananas, oatmeals and rice, which thicken the stools, and limit creamy, fried, sugary foods when you're having diarrhea. People suggest probiotics during diarrhea, but I'm not very sure of that because probiotics are having numerous strains, so you should ask your doctor which would be suitable for you, or even if you're allowed to take a probiotic or not. And in some cases you can take antidiarrheal drugs, but if you're an IBD patient, then it's better you ask your doctor before taking an antidiarrheal drug, because it is not suggested, usually not, because it is usually not suggested in having diarrhea. Is like, you know, you're handcuffed, or I should say butt cuffed to the toilet, and it interferes with your regular life, and it interferes with your regular life, with your social life. That's it for today, and we'll talk about shit a lot more in the upcoming videos. Thank you for watching. Please subscribe to my channel and like my videos, and press the bell button so that you can get notifications whenever I upload a new video. Thank you. Take care and bye bye.